Your prostate gland sits just underneath the base of your bladder. Your urethra, the tube that your wee goes through, runs through the middle of it. Now, your prostate gland naturally tends to start getting bigger from about the age of 50. But prostate cancer also becomes much more common as you get older. Some people, however, can get it much younger, especially if it runs in their family. And Afro-Caribbean men are at particularly high risk. Prostate cancer is the third most common cause of cancer death in the UK. So it is common and it is important. One of the problems is that the symptoms of prostate cancer are very similar to the problems of non-cancerous, what we call benign prostatic enlargement. And they include needing to go to the loo more often, having to get up at night to wee, having to rush to get to the loo, but when you get there, having to wait ages for the stream to come, the stream not being as strong as it was, and dribbling. However, if you do get those symptoms, it is worth getting them checked out with your GP. Prostate cancer is usually diagnosed on the basis of a blood test called a PSA. If this is raised, you'll be referred for a biopsy where they take cells from the prostate gland. There's a huge difference between how aggressive different prostate cancers are. In fact, it's almost normal for men, particularly over the age of 80, to have what we call a benign-ish or a dovish prostate cancer, which wouldn't do them any harm. So treatment will also vary dramatically depending on how aggressive your cancer is, whether it's spread or not, and if so, how far, and how old you are. If you're older and you have one of the least aggressive forms of prostate cancer, your doctors may suggest that it might be worth doing something called watchful waiting, where actually there is no treatment and no follow-up. But obviously, if symptoms develop, they step in. The next option might be active surveillance, and that would be where a relatively non-aggressive cancer wasn't treated, but the doctors keep a regular eye on you so they can step in if it shows any sign of spreading. The alternatives would include radiotherapy, surgery, sometimes fairly radical surgery, and perhaps later on, hormone therapy. Chemotherapy is not often used in prostate cancer.